Good afternoon, everyone. We're just going to give it just about a couple minutes for the rest of our colleagues to join. And while you're waiting, if you can fill out the pre-session survey, that's the link is right there in the chat. So this is our fifth and last microlearn of our September series. Today's microlearn is brought to you by Project Firstline Rhode Island under Rhode Island Department of Health in partnership with the CDC. And the Project Firstline Rhode Island team is behind the scenes in support of this webinar. And as I go through the session today, there are some great resources that I refer to, and these will be shared with you later on this afternoon. So this afternoon, you're going to receive a copy of this slide deck along with the links to all the resources that I go through. My name is Lisa Ledoux. I'm one of the infection prevention training liaisons for Project Firstline Rhode Island. So today's microlearn is on diarrhea. What should you do when you see a patient with diarrhea? I'm going to review what a microlearn is and then break down the key points and show you how you can use it in your workplace and share with your team. Before presenting a microlearn, check with the policies and protocols at your facility and adapt the content accordingly. Incorporate microlearns into existing opportunities where groups of healthcare workers gather, such as pre-shift huddles or at team meetings. The session should be led or facilitated by an experienced team member with infection control expertise. The microlearns reinforce infection control concepts when risks are observed in patients or in the patient environment. And if a team member witnesses a patient in distress, such as shortness of breath or bleeding, they should respond to the emergency per facility protocols. And here's our agenda. We're next going to go over learning objectives. I'll introduce what a microlearn is, identify the risks of diarrhea, what to do if you see diarrhea, and infection control actions to prevent the spread of infection. And then we'll wrap up with our key takeaways and end of session feedback. And if there are questions, we will have a Q&A session also. So learning objectives for today's session. Know the germs that cause diarrhea. Recognize the risks when you see a patient with diarrhea. And know the infection prevention and control actions to take when you are caring for a patient with diarrhea. The Project Firstline Infection Control Microlearns are a series of guided infection control discussions that provide brief on-the-job educational opportunities. And each microlearn focuses on a single infection control topic and connects infection control concepts to immediate practical value. Healthcare workers can easily apply the key points to their daily work and perform the recommended actions to keep germs from spreading. The microlearns can be incorporated, as I mentioned, into opportunities where groups of healthcare workers gather at, change of shift huddles or any in-services or meetings. And each microlearn contains a discussion guide, which is on the left of the slide, and also a job aid, which is on the right, in which the facilitator can use to guide the discussion and use as a resource. The trainer can use these talking points accompanied by the job aid and engage their team in short, focused discussion. So I'm going to go through each of these talking points today. We're going to start with introducing the topic, expand on that topic, discuss with your team, and then wrap up and reinforce. So first, you want to introduce the topic to your staff. Today's microlearn topic is diarrhea. We will discuss key points and what you should do if you are near a person with diarrhea. So what is diarrhea? It is liquid stool. All stool is full of germs. Diarrhea can be caused by many things. It could be a sign of a pathogen. Some germs are hard to kill. And some causes of diarrhea can be C. difficile, norovirus, rotavirus, GI disorders, or effects from a bowel prep. Next, you want to expand on the topic. What are things that you should know and what you can do in your healthcare role? So you want to recognize the risk. The gut is filled with bacteria and some yeast, which are part of a healthy immune system. Most gut germs don't cause problems in healthy people, but they can cause infection when they spread. Germs in stool can spread onto hands and skin when wiping or changing a diaper, for instance. And here are some healthcare tasks that involve the gut. Toileting or providing personal care for your patient. Laundry. You want to handle soiled laundry by keeping it contained and away from your body as you place it in the dirty linen bin. And another task is bathing a patient. Infection prevention control actions can be such as using gloves when you are working with a patient with diarrhea or in their environment. Use a gown if there's a risk that you might get stool on your clothes. Clean and disinfect the patient's environment frequently with the correct products. And clean hands immediately after removing gloves. And as a reminder, gloves are never a substitute for hand washing. Third, you want to discuss with your team. Find out how your audience feels about the topic by asking some questions. And here are some questions that you could ask your audience or staff. And as I go through these questions, if you want to join in and participate and put your answers in the chat, please feel free to do so. So one question you could ask: what do you usually do when you see a patient with diarrhea? What are some things that, that you want them to think about what they would do if they saw a patient with diarrhea? So you'll want to prepare and put on appropriate PPE, right? Anticipate that all items that you will need if you are going to wash up that patient. Make sure you've got everything ahead of time. Gather everything before you go into a patient's room. Another question to ask: do you worry that you might catch something? You may have concern, and it's normal to worry about getting an infection. We know that there are many germs that live in the gut, and we know some infections can cause harm to people who are immunocompromised. You can decrease the worry of getting sick when you know the infection prevention and control actions to take to protect yourself, your patients, co-workers, and taking infection home to your families. Another question to ask: when might you call for help or assistance? So if you anticipate changing and providing personal care to a patient who is combative or has dementia or even a restless young child, you may need a second pair of hands to help you perform that task effectively and safely. Assess if you think that you will be reaching over the bed and know what PPE you will need to complete that task safely. You will want to don a gown, gloves, eye protection if anticipating splashes or sprays. Another question: as a team, how can you help each other take the right infection control actions when you see a patient who has diarrhea? You want to ensure that you can get help and gather all PPE and items needed prior to starting that personal care. And last, another question to have them think about is, do they have all the right tools and information they need to perform their job safely? Make sure that you know where the PPE is kept and how to contact if you need to get supplies. It's very important. Did you perform the infection control actions to prevent infection? Were you wearing all the proper PPE to keep you safe and all the PPE recommended for contact precautions? Did you assure that shared equipment and high-touch surfaces were cleaned and disinfected? So those are questions to ask your team. And then moving on, the last key point is you want to wrap up and reinforce what we reviewed in this microlearn. So reinforce: germs from diarrhea are everywhere, and it can be infectious, right? These germs can be very infectious. Diarrhea is liquid stool. It can be caused by an infection. Diarrhea can also be caused by a chronic gastrointestinal disorder such as Crohn's. And it also could be effects of a bowel prep if a patient is undergoing a procedure such as a colonoscopy or bowel surgery. And you want to protect yourself and others. Cleaning your hands is crucial. Remember, clean hands are safe hands. Using proper PPE such as gloves, gown, eye protection. Cleaning and disinfecting environmental surfaces and medical equipment that's shared among your patients. Handling those linens carefully and managing trash and waste appropriately. And here's a great infographic on germs live in the gut. Some really nice information on that. And again, a link to this resource is going to be sent to you this afternoon with everything. And before we go into key takeaways, I just wanted, if you don't know already, I wanted to let you know that there's an interactive session for you to use with your team. It's a scenario when a healthcare worker is changing a patient's bed linens. And this session walks you through all the appropriate infection prevention and control steps to take for this particular scenario. So again, this will be also sent to you this afternoon, how you can get to that link. And as we wrap up our micro session, here are the key takeaways for today's microlearn. Germs from diarrhea are everywhere and can be infectious. All stool is full of germs. Use proper PPE such as gloves and gown when caring for a patient with diarrhea. And clean hands immediately after caring for a patient with diarrhea and after removing gloves. And here are the references that were used for today's session. And as I mentioned, this is brief. This is the whole purpose of a microlearn, so I appreciate you taking this time. But if you can, please take some time to complete our end of session feedback poll. This always helps us as a team to improve our future trainings and suit your learning needs. If there are any questions at this time, please feel free to put it in the Q&A box. And also, if you did not put your email in the chat earlier, please do so if you want to be on our email distribution list for our future webinars. And as we enter respiratory virus season, please join me October 7th at 12 noon for a 45-minute refresher session. I'm going to be presenting infection control reminders for healthcare workers during respiratory virus season. And I'll discuss the respiratory viruses that will be circulating this coming respiratory virus season, and learn how you can protect yourself and your patients from respiratory infection. So please join me that day. Please tell your friends and colleagues, and join me again on October 7th at 12 noon. I will stay on for just a bit if there are any questions. If you don't have any questions, please feel free to leave. I thank you for your time on this Thursday, taking the time to join me. And I thank you for all that you do in your healthcare role.